So there are couples who, one of the things I mentioned earlier, that's our biggest enemy for fertility is age. From the time you have puberty for women and even for men, you have the ability to produce a child. We try and encourage you to wait till you're about maybe 20 years or, but generally between 20 and 28, 30, your body is about the kind of easiest time you can have a child, or you can get pregnant. For some people, owing to certain circumstances, they are not able to have a child within that window. Knowing that age is our biggest enemy, then we have to look at what are the things that we can do to ensure that we can still maintain our chances to have a child. Then there is the almighty egg preservation, where if you look at the circumstances and recognize the fact that you are unlikely to get pregnant now due to whatever reason, you may choose that you want to freeze your eggs. So you would go to the hospital, we would do an assessment for you, we will give you, if you think it's a good enough reason, we will give you injections. The injections would help you produce plenty of eggs. We will remove those eggs from you and then put them in a freezer until the date and time when you are ready to have a child. So let's give an example. Assuming you are 28 or 30 and you realize that your window, you want to have a child in the future, but you are not ready to have it right now. And you harvest your eggs and put them in the freezer. At 35, you come back and you say, hey, I'm now ready to have a child. Those eggs are still like a 28-year-old woman's eggs. So when they are fertilized and an IVF is done for you, your results, your outcome, your success rate is like a 28-year-old woman's own, because the eggs are still pretty young.